NAD IV therapy is booming. Just look around. These clinics are popping up all over the place. They make lots of claims. However, the safety evidence for intravenous NAD is far less than what these clinics will tell you. This is what you need to know and how to protect yourself. Here's the story that's making its way through the news right now. A 27-year-old woman in the Bronx has died after receiving an intravenous NAD infusion at a wellness clinic. Investigators are stating that the person who performed this procedure stated, quote, "I gave her an NAD IV. She went unconscious immediately and he called 911. And I want to reiterate, she was only 27 years old. Now, does this automatically mean that the IV NAD infusion caused her passing? Not necessarily. Right now, we're still waiting on the medical examiner's report and toxicology findings. However, what we can say is that the woman lost consciousness almost immediately after the IV infusion of NAD began. And I also want to call your attention to something else I noted, and that is the person who performed the procedure reportedly admitted to the police that he was not licensed to practice medicine in New York. According to the complaint, he told the police that he was a doctor in the Dominican Republic, and he was also a licensed physician's assistant in Puerto Rico. However, in New York, he was only licensed as an esthetician. That's a skin professional. There is another aspect of the story to be aware of, and that is this. The FDA has already raised concerns about compounded NAD injections. In 2024, the FDA said it was aware of compounding pharmacies using food-grade NAD powder to make intravenous products. Food grade does not necessarily mean sterile or suitable for IV procedures. The FDA also reported side effects following NAD injections, including severe chills, shaking, vomiting, and fatigue. Some of these people needed medical treatment, and the FDA also stated these side effects were consistent with elevated endotoxin levels. Here's a small investigation comparing what happened when people were given either 500 milligrams of intravenous NAD or 500 milligrams of IV nicotinamide riboside. Now, while only 6 people received IV NAD, all 6 of them reported side effects. Those side effects included abdominal cramping, diarrhea, nausea, vomiting, increased heart rate, throat pain, congestion, and pressure in the chest. And these side effects ended once the NAD infusion was stopped. Obviously, this study doesn't prove that IV NAD therapy is dangerous. However, it does highlight that side effects can indeed occur. Also be aware that despite what you may have heard, there is a severe lack of research on what happens when people get infusions of NAD boosters like NAD, NMN, nicotinamide riboside, and others. Currently, there is no good proof for any of the claims that are being made for intravenous NAD therapy, including anti-aging longevity benefits, better mood, better sleep, more energy, or any of the other things you may have heard about this stuff. And that's why I believe that when you hear about the claims being made for intravenous NAD therapy, you should run far, and run fast. However, if you are determined to do this nonetheless, this is how you protect yourself. Here are 5 questions that you should ask. Number 1, are you licensed in this state to prescribe and administer this IV therapy? Number 2, which pharmacy made this NAD product, and was it tested for sterility, potency, and endotoxins? Number 3, is this condition FDA approved for the condition that you say it treats? Number 4, show me human clinical trials that prove the benefits you are promising for this treatment. And number 5, and this could be the most important question to ask regardless of the procedure you have at an outpatient, non-hospital facility, and here it is: what are your emergency procedures? Specifically ask them, what emergency equipment do you have on site, and what on-site trained personnel are there to help if there is an emergency, such as if you start having breathing problems, chest pain, or God forbid, go into cardiac arrest. When it comes to IV NAD therapies, I'm out. I don't believe the claims, and I suggest you don't either.